labral tear, your patient is in supine, and then the examiner places the hip into full flexion, lateral rotation, and abduction. And then we are going into lateral rotation and abduction, and we are going into adduction and medial rotation. Pardon? This is for anterior. Yeah, this is for anterior. So flexion, abduction. Anterior is abduction. Okay, flexion, abduction, and external rotation. And you are going into extension, adduction, and internal rotation. Versus in case of posterior labral tear, we will go into opposite. Flexion, adduction, and medial rotation. So we start with flexion, adduction, and medial rotation. So how you can remember this is for posterior labral tear, because posterior, right? So we are trying to go away from it first, and we are going into it, like extension, abduction. We are going into it. So we are starting from the opposite. Versus in anterior labral tear, flexion, abduction, because anterior is in the front, we are starting from away. So posterior, we are starting from away because it's posterior here. So we keep the leg first here. We don't have to put the pressure. We just keep the leg here, flexion, adduction, and internal rotation, and we are going into that posterior side. We are trying to compress into that posterior side. So extension, abduction, and external rotation. Right? So you take it into full extension, abduction, and external rotation. Okay? So just remember it this way. For anterior, we start from posterior. For posterior, we start from the anterior side going to the posterior side. Or if you can remember that mnemonic, then it's easier. The short form, then it's more easier. Okay? Practice.